For patients suffering from severe, persistent conditions like advanced cancer, pain is an exhausting physical presence. It dictates sleep, restricts movement, and demands constant management. Standard oral pills often fail to manage this effectively. We see sharp spikes in drug concentration shortly after a pill is taken, offering intense relief. But these inevitably plunge into deep troughs, where the drug wears off and the pain violently returns. On top of that volatility, the sheer physical act of taking pills becomes a barrier. Severe illness often strips away a patient's ability to swallow, or causes constant nausea that rejects oral medications entirely. This creates a strict medical requirement. The patient needs an unbroken, entirely stable baseline of pain relief, and it has to completely bypass the digestive tract. The transdermal fentanyl patch was engineered to fill this exact gap in palliative care. It is a precise delivery vehicle. It relies on a heavily concentrated formulation of synthetic opioid, leveraging the barrier of human skin itself to act as a highly controlled, multi-day IV drip. The process begins at hour 0, the moment the adhesive matrix makes contact with the patient's skin. Notice the skin cross-section. Fentanyl molecules do not drop straight into the bloodstream. They leach from the patch, pooling in natural fat tissues. Because this tissue sponge must be completely saturated first, it takes 12 to 24 hours to reach therapeutic levels. During that long initial lag, the patch is completely useless for sudden flare-ups of acute pain. Doctors must prescribe fast-acting oral opioids to bridge the gap until the transdermal delivery catches up. That severe delay is a deliberate, necessary trade-off. By forcing the drug through the skin's fat layers, the body creates a bottleneck. It prevents a lethal dose of fentanyl from hitting the heart at once, slowly building the foundation for long-term stability. By the 24-hour mark, the initial pooling is complete, and the drug reaches a steady cruising altitude within the circulatory system. From the blood, the fentanyl continuously crosses the blood-brain barrier. Here we see an abstraction of the central nervous system. The shape of the fentanyl molecules allows them to lock seamlessly into matching mu-opioid receptors, the specific sites on nerve cells that manage pain signaling, halting the energetic transmission of pain. The patient finally achieves a continuous background of comfort. The intensity of their pain is consistently reduced for 2 to 3 full days without a single pill. But suppressing the central nervous system around the clock guarantees persistent systemic side effects. Because continuous opioid use heavily slows the digestive tract, routine laxatives are mandatory.